Welcome to our second talk in the Emotional Perspectives of Genetics track called Communicating About a Genetic Diagnosis with Children and Siblings. It is my pleasure to introduce you to Amanda Gerard, a pediatric genetic counselor at Baylor College of Medicine and Texas Children's Hospital, as well as Abbey Guza, a licensed clinical social worker at Arcadia Counseling Services, which is a partner with Integrated TherapyWorks. Please refer to the attendee website for complete bios for our speakers. Please reference your screen for CEU accreditation and disclosure statements. Our speakers do not have any disclosures. You can also refer to the Continuing Education tab in the attendee website to review this information. On the right-hand side, you can see the learning objectives for this talk. With that, we'll stop sharing and we'll allow our speakers to start their talk. Thank you for joining us.
Thank you, Blake. Let me get my screen set up real quick. Okay. So thank you everybody for attending this talk. So as Blake said, I'm a genetic counselor at Texas Children's Hospital in Houston. I do not have any conflicts of interest to disclose. And in terms of the talk today, this was a talk idea that I came up with from just some experiences that I've had and questions that I've received from families that we see in clinic and that I've observed in some different support and advocacy organizations that I'm involved with. So I wanted to open up a discussion and share some tips that I've learned from some families that we see in our clinic and different reading and kind of research that I've done into some of these topics about ways to talk about conversations regarding medical and genetic information with children. For the first half of the talk, I'm going to share kind of some broad information. I realize that we have a very diverse audience in terms of the diagnoses and the medical issues that we may be talking about, the ages of your children, how many children you may have who are affected with a specific diagnosis versus not affected. So there are obviously a lot of different factors at play here, but I hope that some of the information will be relevant for everyone and you can kind of use it in the way that's most applicable to you and your family. And then for the second half of the talk, Abby and I will talk a little bit more specifically about unaffected siblings and some needs and resources that are available to them. So I'm obviously going to talk about some of kind of my experiences and things that I've learned, but I do want this as much as we're able to be kind of an open discussion. So if you have resources that you would like to share, experiences, tips, please feel free to share those in the chat for others to have access to as well. And then we of course have the Q&A at the end. So before I get into some of the details of kind of some tips and information about having some of these discussions, I want to talk briefly about why these discussions may be beneficial in the first place, because it can be quite difficult sometimes to have some of these conversations and talk about some of these topics with kids. So sometimes families do have questions about, is this something that I should be talking to my kids about at all? And that, of course, the degree and the amount and type of information that should be shared can vary a lot depending on the child and their age and what's appropriate. But generally, we do see, and research has shown that children can be quite perceptive and often are able to sense what information is withheld from them, particularly if they're the ones who are going to medical appointments or have a sibling who's going to medical appointments. Even if they're not asking questions, they may not always do so for fear of upsetting their parents or kind of adding additional burden that they are perceiving their parents are experiencing already. And they may even sometimes make up their own explanations for things they don't understand. And kid brains can work very differently from adult brains. So some of the explanations and things that they may come up with may be very off base or may actually be even worse sometimes than what the reality is of whatever's going on. We also know, and this is probably not a surprise to many of you, but jealousy and resentment can sometimes happen between siblings when there is some sort of discrepancy in terms of the amount of time or attention that one sibling is getting versus others. And particularly if children don't fully understand why that's happening, that can sometimes worsen some of those issues. So having open communication and understanding about what exactly is going on and why one sibling may have more needs than another at certain times can be helpful to help mitigate some of those issues. And then we also know in general, even for people without a genetic diagnosis, that having a poor understanding of health and genetic information can lead to poorer care outcomes for people in adulthood. So the transition from teenage years to adulthood is in general an area where we often lose a lot of patients to follow up in healthcare. They may not have a full understanding of kind of what their medical needs are. They may not feel confident in how to manage those medical needs if it's something that their parents have been doing for them throughout childhood. And then with a genetic component, there's also this kind of added layer of potentially inheritance or information related to reproductive decision making. And so having a good understanding of somebody's health diagnoses or the genetic condition and the inheritance of that within the family can be really helpful to people as they age, in terms of managing their own healthcare, helping to manage the healthcare of siblings, or in making informed reproductive decisions and family planning decisions for themselves. This could be a full talk in and of itself, so I'm just going to talk about it very briefly, which is not the justice that it deserves, but I do want to acknowledge that it's really important to help yourself in order to be able to help others and help your children and support them. And so as a parent, it is so important to be able to find time as you're able to. I know this is on top of all the other million things you have going on in the day, but be able to care for yourself and find support resources and find ways to educate yourself and feel confident to the extent that you're able to, and kind of your understanding of what's going on in order to be able to explain it to your children. Kids take so many cues from their parents in terms of how to process their emotions and care for themselves, both now and as they get older. And so it is really helpful and important to try to model those behaviors for them as much as you're able to, and to care for yourself in order to be able to most effectively help support them and have some of these conversations with them. And so having those things out of the way, I want to get into a little bit more of what the focus for today's talk is about, in terms first of preparing for having a conversation about a specific medical or genetic topic with a child. So first, it's really helpful to think about where and when you may want to have this conversation. So do you want to talk to your children together? Where is a place where they will be comfortable having potentially a difficult or kind of in-depth conversation? When are quiet moments that you may have throughout the day to sort of dedicate time to thinking about some of these topics with them? That being said, though, it's not uncommon for children to also start these conversations on their own. So I've seen in research and I've heard patient experiences of kids kind of start asking questions on their own sometimes. And so it's also helpful to start thinking about some of these things early. And it's okay too, if it's maybe not the best time to talk about something, to say, that's a really great question. Why don't we talk about this, after dinner later, or at a better time to have that conversation. Think about what are the key things that you want them to understand right now. And especially for younger kids, that may just be one or two things for one conversation. They may not have the attention span to sit down and have, a detailed conversation about their whole genetic diagnosis. So it can be really helpful to kind of ground yourself in one or two things that you really want to make sure that they kind of take away from a specific conversation. And there will always be times to go back and have more conversations later on. And that also ties into, you don't need to have the answer for everything. I can get caught up in this even as a genetic counselor talking to adults. Sometimes I feel like I, need to research every single thing and be prepared for every single question that somebody could possibly ask me. You don't have to do that, and it will give you a big sense of pressure to feel like you have to. It's okay to not know the answer to something. And it can be really helpful to model for kids. I don't know the answer to this, but let's look at it together, or let's ask your doctor the next time we go see him or her, and to show them ways that you are able to kind of help find out answers for things that you're not sure about. And then, of course, you want to think about their age or what their developmental or cognitive status is and what types of information they may be able to understand depending on that. And so that's what I have on the next few slides. I'm not going to talk through everything on these slides. They're a little bit busy for time's sake, but all of these slides are on the conference website. So you're welcome to kind of look through these more as you have time. So for kids who are functioning at a preschool level, so functioning at about the age of a 3 to 5-year-old, they often will ask a lot of questions, but as I mentioned earlier, sometimes kid brains work a little bit differently from adult brains. And if you're not fully clear on what they're asking you, it can be helpful to kind of ask some follow-up questions. Where did you hear that? You know, what have you heard about that already? What do you remember your doctor saying about that? Because oftentimes young kids are very focused sort of on one specific question. You may not be able to fully tell what that is initially, and you may be thinking about a bunch of different potential answers or kind of things that could come off of that question, whereas they may not be. They may have just kind of one thing they're wondering about. So it can be helpful really with this age group to also focus on that, you know, one or two things that you really want to make sure they take out of the conversation, because they can have difficulty with multi-step information or very elaborate things. They tend to have quite short attention spans. So being kind of focused and focusing in on one or two specific things can be really helpful for kids who are functioning at this age range. Older kids, so kids who are functioning at about the level of a 6 to 12-year-old are starting to get a longer attention span, and they will be able to understand a little bit longer and direct information that has more steps. But they are usually still thinking oftentimes kind of in more concrete or literal terms. So they may not ask as many questions as an older teenager might about kind of more abstract concepts or kind of broader questions about the future. That, of course, though, is really dependent on the child. And these are all kind of general things. You know, your child may be a little bit different in some of these. But for kids, as they're getting to the school age level, it can also be helpful to start kind of engaging them in getting answers to some of their questions. So if you're not sure of the answer, maybe telling them, let's ask the doctor or the nurse this the next time we go in for your appointment, and finding ways to start engaging them in their own healthcare, which can be really helpful for them to see and to get comfortable with as they're getting older and starting to potentially manage more of that care for themselves or for family members. And then for teenagers, so people who are getting older, ages 13 to 18, are functioning at about that level, they will probably have more kind of abstract questions, more questions about how things will impact their day-to-day life, and more questions about how things may impact them in the future as well, and sort of what their future or their treatment may look like. That being said, though, they are still learning. They don't have a super long experience in handling complex issues, so it's still very important for parents to be involved. But it can also be really helpful, as I said, for younger children as well, to involve them in having some of their questions answered, talking to their healthcare providers. Support organizations can be really helpful for this age group, or having them talk to friends or find other ways to express their feelings or kind of their questions as well, if they're not as comfortable talking directly to a parent about some of those things. And so those are kind of some general tips for things to think about when you're preparing to have a conversation about some of these topics. In terms of actually sitting down and having the conversation and navigating that as you're going through that process, this was an infographic that I took from the Encourage Kids Foundation, which is more focused on childhood cancer, but they have some good resources that can kind of translate over to many genetic diagnoses as well. So they talked about how important it is to assess how much a child knows. As I mentioned earlier, kind of getting a good idea of what their understanding is and what their questions are, helping them to affirm things that are true, correct things that may not be true, and help give them accurate information about what's going on to the level that's appropriate for them. Think about how much information to share without being too overwhelming. So again, going back to kind of having some of those goals that you want to take from a specific conversation. Helping them understand basic facts and what to expect in the medical process. For younger kids, this will probably look more like what to expect within the immediate future, the day-to-day. For older kids or teenagers, that may start to look more a little bit kind of abstract and future-related questions as well. Encourage them to express their emotions, be open and let them know that you really are open to talking about their questions. And if you are experiencing emotions or having a difficult time with a certain conversation, it's okay. Kids take a lot of cues from their parents, as I said earlier, and it can be helpful for them to see that you have specific feelings related to this as well, and kind of how you cope with and manage those feelings as well. And then it's always important, even if a conversation may be particularly difficult or kind of leave things at an uncertain place, to offer them messages of support and love. Let them know that you are here for them and that you're going to support them and help them throughout every step of this journey that they may be going through. And then just a few last kind of tips from things that I've read or experiences that I've had. Open-ended questions can be really helpful to help gauge anyone's understanding, and this applies to kids as well. So try to ask things that they can't just answer a simple yes or no to. So questions like, what have you heard about this? Or what have you read about this? How do you feel about this? Things that they have to elaborate a little bit more on to answer. And that can be really helpful with kind of gaining information about what they're thinking and what questions they may have or what things they may not be fully understanding. Asking someone to repeat what they understood back to you in their own words can be really helpful as well, to make sure that they kind of took what you wanted them to take away from that conversation. And then for kids, they sometimes may have questions or be anxious about how to explain to strangers or friends or other people who ask them about what's going on, what they should say. So a couple helpful things can be making a little elevator pitch with them. So like 2 or 3 sentences of what they can say about their diagnosis or their sibling's diagnosis if somebody is asking them questions, talking about questions that they might get from other people and kind of how they want to answer those. So that can help with both kind of anxiety and with making sure that they have a good understanding of what's going on. And then I've touched on this, but sometimes children and young children in particular can make associations in their brain that we may not expect at all. And there have been many studies that have shown that sometimes if there is a genetic diagnosis or a specific medical issue going on within a family, sometimes kids, for whatever reason, assume that they caused that in some way. So they may not be able to fully understand genetics and DNA depending on their age and sort of where they're functioning at. But it is very helpful to reassure them that they did not cause this to happen in any way. And then I've touched on this briefly as well, but these are conversations that will happen over time. It's not feasible, particularly with a child, to discuss everything at once in terms of a genetic diagnosis or medical issues that may be going on. Particularly for younger children, they may also need to hear something multiple times. It's okay if you tell them something once and then a few days later they maybe ask the same question or seem like they didn't fully understand. There may not be one specific kind of light bulb moment where they say, oh, I totally get this now. It'll be a process over time. And over time, as you keep answering their questions and explaining things to them, they will get it eventually, and it'll kind of sink in a little bit more. And then, of course, keep open lines of communication. As kids get older and as new scenarios play out, their questions and their feelings are going to evolve. So it's always helpful for them to know that there is a resource to help support them and answer questions that they have. And so I have a supplemental handout that should be on the website with some information about helpful resources that can be shared with kids and used to help navigate some of these conversations. There are a lot of great children's books. There are some video resources and many websites and great support groups, movies as well related to genetic diagnoses or medical issues. And then, of course, this also isn't something that you have to navigate alone. So engage your healthcare professionals, engage the people who are helping support you as well. And they may be able to help with navigating some of these conversations or giving suggestions too. So as I said, there are a lot of resources on that handout that I have. I'm just going to touch very briefly in this talk on some children's books. So we actually have a small patient library in our clinic that some of our families helped suggest books for. That's really lovely, and we're able to give those books to some of the families that we see in clinic. One great series is The Abilities in Me. This is a series that has different children's books about several different genetic diagnoses and different medical issues that can happen in childhood. P.K. Hallinan has a great book called A Rainbow of Friends about the beauty of kind of us all being different and living with differences. Unique, which is a family support organization, has several good children's books about different chromosomal syndromes. And then We're All Wonders is a great young children's book that is based off an older children's book and movie called Wonder, which some of you may be familiar with. It's a movie that came out a few years ago about a boy with craniofacial differences. So these are a few of the books that we have in our clinic that we really like, but there are many others out there. Some are on my handout, and then many also are not on my handout. So definitely something to look into if this is of interest to you. And if people know of other ones too, feel free to share those in the chat. So that is my part of the talk that's focused a little bit more broadly on kind of general information that you may be able to apply to different children in your family in different ways. But for the second half of this talk, Abbey and I are going to focus a little bit more on talking specifically about siblings, unaffected siblings within the family. There has been a decent amount of research, and from my own experiences in clinic, I would say that I've seen that shows that siblings often are the most overlooked family members in terms of support needs and informational resources that are available when a family is going through a genetic workup or through different health issues within the family. So I wanted to focus a little bit of time specifically on them. And I'm going to talk about a couple of different articles. I'm just going to talk very briefly about kind of some of the very high takeaway points from these articles, but I did include them here and in my references on the slides as well if people want to read these in their entirety. But the first one I'm going to talk about is an article that came out several years ago in the Journal of Genetic Counseling, and it was an interview-based study that was where they essentially sat down and talked to several different families about the genetic diagnosis and the family communication about that diagnosis. So they sat down and talked with both parents and with unaffected siblings, and the families included in this study had children who had several different types of genetic conditions. So within the course of this study, they did find that siblings reported a lower degree of knowledge than many parents were expecting them to. So they talked about how even just through the interviews, when they would ask siblings questions, and sometimes siblings wouldn't know the specific answers or wouldn't know as much as parents expected, many parents did express surprise and would kind of say, I thought I had talked to them about that, or I didn't realize that I hadn't, explained that to them specifically. And there was a decent amount of surprise from many parents when they kind of sat down and talked about these issues specifically in terms of the amount of understanding that some of the unaffected siblings had. They were more likely to learn or understand things more related to kind of current symptoms management, things that they were observing in their day-to-day life, and then were less likely to know or seem like they were informed about kind of more abstract concepts, with which genetics is one of those concepts. So they specifically usually did not learn anything about their specific carrier status or their genetic risk related to that diagnosis until their teens, or when they were kind of approaching adulthood and potentially thinking more about their own family planning. But interestingly, several of those children did say that they had worried much earlier about their genetic risk and just did not ask their parents because their parents were already going through so much and they didn't want to sort of add to that burden. Several of them notably also did say that they worried about a specific risk for themselves to develop whatever that condition was, but some of them had already actually been tested for that condition and were known to not be at risk, or just based on the inheritance were known not to be at risk for that condition. And just they had never specifically asked about that, and it hadn't been specifically explained to them before. Notably, this kind of ties in with that. They generally said that they were open to receiving information and that they did value having ongoing discussion about genetic and other types of information within their family. And none of the participants, either the parents or the children, suggested any regrets about any of the information that had been disclosed within the family. Then they talked about how resources available to siblings are limited. And because of this, often the immediate family or the parents were the primary source of support for siblings, which also kind of highlights the importance of having some of these open discussions with siblings specifically, because that's often where a big source of support is for them. So that's that article. The other article I will talk about briefly is an article that was focused more specifically on one genetic condition, Angelman syndrome. And this was a survey-based study. So this was an online survey that they sent out to several families within the Angelman Syndrome Foundation. And there was a study based specifically for parents, and then one that was based specifically for unaffected siblings to take. And so the sibling survey had several questions about their knowledge of Angelman syndrome. And I meant to mention this was siblings ages 5 and up that were included in this study. About half of them answered all of those informational questions correctly. But then the majority, including many who had answered all of those questions correctly, also said that they still had more questions or more information that they did want to know about Angelman syndrome. Another part of this study was that they asked them about their emotions that they experienced related to the diagnosis in their sibling. Probably not surprisingly, there was a huge spectrum of emotions and frequency of different emotions that siblings reported feeling. And they asked the parents as well to comment on how often they thought that their children were experiencing these emotions. Oftentimes parents were pretty spot on with that. The one discrepancy that they noted was that many parents overestimated the frequency of feelings of sadness in their children. So parents were more likely to say that they thought their children felt sad more often than the children actually reported feeling sad in their day-to-day lives. I think that's notable because these obviously can sometimes be very difficult conversations to have. And I know sometimes a barrier to that can be that we don't want to upset or burden people in talking about some of these things. But at least within the context of this one study, they did see that some of those feelings may not be occurring as frequently as we may sometimes assume that they are. This was a quite notable finding to me as a healthcare professional. They also asked parents how often a healthcare professional had specifically talked with them about disclosing the diagnosis to unaffected siblings or kind of issues related to unaffected siblings. And it was very uncommon for parents to say that a healthcare professional had talked to them about this. I think in the same way that for parents, you know, there are obviously so many things going on in a day and so many things to try to talk about and manage. The same is true within a healthcare session, within a clinic appointment. We have so many things that we're trying to explain and help families with, and this is something that can sometimes fall under the radar. So for me as a healthcare professional, this was quite significant to me. And I have been thinking about ways within my own practice in our clinic that we can try to help encourage some of these conversations, even if it's just having resources or kind of handouts or a brief discussion, at least sort of starting some of the conversations about these issues without having to, you know, cut into a huge amount of time of a clinic appointment. And then they again endorsed the need for more informational resources for children and siblings. And as part of this study, they actually wrote a children's book about Angelman syndrome, which we have in our clinic. It's a great book. And there are a lot of other books that are out there that are focused specifically on siblings as well. So The Abilities in Me, I really like this one, has one called Superstar Siblings. The other ones that I'm showing here are usually for a little bit of older children, but there are many other books that are out there as well for siblings of many different ages. So again, if anybody knows of any, feel free to share those in the chat. I would love to know about them for our list. And then this is my last slide before I turn it over to Abbey. But in terms of kind of wrapping up things about sibling resources and support, I know this is yet another ask in the limited number of hours that we all have within a day, but it can be really helpful, even if it's, you know, every now and then, to try to make special time for siblings. Within these studies, they talked very significantly about how much they valued getting specific time and attention from their parents. And many of them did understand why their affected sibling needed more time, but they still appreciated having some degree of special time for themselves and their questions and discussion as well. Sibling specific support groups can be really helpful, but they are a bit limited. We do need more of them. Blake actually and I are looking at starting one in our clinic, and I know there are some other genetic counselors and professionals who are looking at this, but it's certainly still a need. And that's part of my goal in giving a talk like this, is to try to help kind of spread awareness and get people thinking about some of these issues. There are children's books out there, as we talked about. There are some great sibling support organizations that I listed on my handout. And I think Abbey will talk a little bit about those as well. And then SIB Shop is also a great resource. So I'm going to turn it over to Abbey and let her talk a little bit about that.
Thanks, Amanda, so much. My name's Abbey Guza. I am actually located in Missoula, Montana. I'm a licensed clinical social worker. I work with a wide variety of individuals, but a lot of the clients that I see are often siblings who have, or kids who have a sibling with a disability or with another diagnosis. So I'm just going to talk briefly about SIB shops for those of you that are unfamiliar. I've been running SIB shops a couple times a year for the last decade. What SIB shops are a really fabulous, fun get together for kids. The creator, Don Meyer, is a adult sibling of a sister with Down syndrome. And he said that he wanted SIB shops to be a little bit of learning for kids and then a ton of fun. So it's a little bit like summer camp for our SIBs who are our typical siblings. And they get to come and have a really fun time. We usually do lots of games, but the biggest thing I think that kids get out of these groups is getting to find a community. And I know Amanda just touched on that so often I think our families feel isolated, and our siblings definitely tend to feel isolated because not only are they maybe feeling like they're a little bit in the background next to their sibling who has something else going on, but they often don't have friends who have siblings with differences. And so it's a great resource in our community, and we recently have started doing them virtually since COVID. And so we found that actually is reaching a lot more kids. I was, at first, it felt a little, I don't know, just a little awkward to be doing things online, as we all know. But what we found is it helped kids, it helped us reach kids in rural communities in Montana, and also helped people just find each other in communities in Montana. And we just know that that's so important for SIBs. So I also wanted to just talk a little bit about some of the kids that I have worked with in this setting. I was going to give you guys a quick story, and then I'll share a couple resources, and then we're excited to get to answer some questions too between Amanda and I. But I had a kiddo that was a part of SIB Shop probably 8 years ago, and he started out, he had a brother who had both some genetic differences as well as a mental health diagnosis. And he was just really struggling. He felt like he was pretty alone. And even when he would come to SIB shops, he always kind of stayed in the background. He needed some extra attention. Oh, I'm sorry, I just got a note that it's been hard to hear me. I'm sorry about that. But he always kind of needed some special attention in our groups. And he really found a community in SIB shops. He was able to get connected with other kids. He found some kids that weren't at his school, because that's often where our kids are finding friends. He found some other people in our community he could spend some time with. Fast forward about 8 years, and he's now a leader in our SIB shops. He comes as a helper and as a volunteer to help teach other kids. And real quick, before we jump to questions, I just wanted to note a couple resources I have on my slide here. The sibling support groups are awesome. They have a bunch of online support for kids. I think a lot of the groups are through Facebook now, but they have online support groups for teenagers, online support groups for SIBs that are in their 20s. I think they have one specifically for SIBs that are like 30 to 40. They have all these smaller groups. They also actually have some groups for parents. They have some online groups for grandparents on there. So that's a great resource for individuals that maybe don't have SIB shops in their communities. And then the Sibling Leadership Network is on my slide as well, and hopefully can offer some more information for you guys. I will have Amanda just briefly put my contact information up here. I love to talk about siblings. I love to kind of navigate communities and help people get things figured out in their own communities. So if you have any interest in starting SIP shops in your community, please feel free to reach out, and I can get you hooked up with places where they're offering some trainings. Feel free to call or email, and I'm excited to chat with you. Thanks so much.
And then I have my screen will move. Just my references briefly, which are listed on the PowerPoint in the website, and then my contact information here as well. And I will let Blake let us know if we have any questions.
Thank you so much, Amanda and Abby, for this wonderful presentation. And for those of you listening, please feel free to enter any questions in the Q&A tab within the attendee website. We do have several already that are amazing. So we'll start with this one that a couple people have asked in different ways, but occasionally we come across families who are resistant to disclosing the diagnosis to their child. Can you talk about you or your clinic's approach to navigating this?
Yeah, that's a great question. And we definitely have that experience as well, which is why I talked a little bit about that in my first slide. It is difficult. I don't think I have a 100% will always work for everybody answer to that, unfortunately. But I think within our clinic, we do try to be respectful of the family's wishes and go with what they decide. But we do try to talk a little bit about some of those things I brought up in my slides about how kids may be wondering, and especially if they're coming to the appointment, sometimes families will want to leave them in the waiting room or kind of like have them leave for certain parts of the discussion. And especially for older kids, we try to talk a little bit about, they probably do notice that and wonder why they can't participate in that part of the session and what's being talked about. So I don't have a 100%, like I said, always works answer, but I think just being respectful and having those conversations and trying to respect what people's wishes are, but also talking about reasons why there may be, to some degree, some benefits to talking about certain issues with them.
Great, thank you. And I think in line with that, there's another question. What if a family's cultural beliefs are of the thought that the topic of diagnosis or disability is taboo or something that's not discussed with others like their children? Specifically for this, do you have any experiences with this kind of topic of culture coming up in these conversations? And do you have any specific resources for that?
Right, that's a great question too. You guys have wonderful questions. I would say within our clinic, it's again trying to be respectful of some of those differences and engaging whatever parties we're able to kind of help with mediating some of that. We have really wonderful interpreters and other resources within our hospital who can sometimes help us with navigating some of those conversations. And there are some other resources out there and support organizations that can be helpful, but that can definitely be a difficult area to navigate as well. I don't know for you, Abby, if you have anything you want to add. I don't want to answer all these questions for you.
No, thank you, Amanda. I think the only thing I would add is I think for me, it is always helpful to talk with families just about what we know in research. And what we know is that kids will answer questions on their own. And we really want to make sure that they get accurate information. And when they can't get answers, they also will create answers. And so I find that sometimes it's just helpful to talk with parents. Like we know your kiddo is going to find answers one way or another. And what we don't want is for them to feel scared or have misinformation. And I find sometimes that just helps open that door a little bit for parents, even just to start thinking about those conversations.
Thanks for bringing that up, Abby. That's a great point.
Thanks.
We do have some people thanking you for the book list. It was wonderful that you shared all the resources that you're aware of. Someone asked if you have any resources for books or other documents in Spanish or Vietnamese or any other languages. And for those of you who are watching today, if you have some recommendations as well, feel free to put those in the chat.
Yeah, we're always looking for resources like that. So definitely if people do have resources they know of, please share those. I do know for some of the the books that we have, they are available in Spanish. I can only think of a couple though, to be honest. There's definitely a big need for books to be translated into other languages. So if anybody whoever asked that question wants to email me, I'm happy to kind of look at our list and send any that I know of. I don't know of them off the top of my head. I do know that we have a few in Spanish language though, but it's definitely a big need.
I was also just going to add that first website on my slide, the Sibling Support Project, they have some great book lists on there divided into age groups. And they, I believe, have a few Spanish resources on there too. So just another place to look.
Thank you. Next question. Is survivor guilt found or addressed in siblings of children with rare disease?
It definitely is found. I would have to read up a little bit, to be honest, about how it was talked about, but I do definitely know that it has been mentioned in some of the articles that I talked about. So it should be in there if you kind of look through those in more detail. Certainly, though, it is something that siblings report and struggle with. I don't know for you, Abby, you probably have more experience in actually addressing that than I do. So I don't know if you want to add anything about that.
Yeah, I think we certainly do see that in siblings. And again, I think this is kind of back to what we already talked about, where information just becomes so powerful. It helps kids at least get a little bit of a concept or some context about maybe why they're experiencing something different than their sibling. And then any sort of, obviously, any ways that we can address just some of those big feelings that they're having. Can be so helpful, whether that's through support groups or individual therapy or just getting families some extra support.
Great, thank you. Another question here is, have you noticed a difference between siblings and maybe how a twin would handle this type of situation? Could a twin struggle more with the twin sibling having a diagnosis or needing more care and attention?
That's a great question. I've not read anything that touched on that specifically, and I can't think from my personal experiences of anything I've observed, but I think that makes, in my head, that makes sense as a phenomenon. I don't have any specific experience with observing that though. I don't know if you have seen that before, Abby.
I haven't, no. I mean, I think same as you, Amanda, I would say it does make sense that would maybe be just another layer of the dynamic to navigate. But yeah, I don't have any specific examples that I've worked with.
All right, so we still have a little bit more time for questions. One of these questions is, how do parents begin to address a child's terminal diagnosis with their child and their child's older sibling? In this case, the child is 3 but developmentally delayed, so probably couldn't understand anything yet. How do parents know when it is the right time?
That's a great question. And I'll let Abby comment too, but I think part of my answer, which is a little bit of a non-answer, but it's that it depends on the specific child and kind of the dynamics there and what you feel is best for them as a parent. Every child is a little bit different in terms of kind of when they're ready to talk about information like that and what they may or may not want to talk about. I think it can be helpful to ask them questions too, as much as you're able to in how to guide that conversation. So something I read as I was kind of preparing for this talk, touched a little bit on that and talked about how, for example, if your child asks you, am I dying or am I going to die? It may be helpful to ask them, well, do you feel like you're dying, or why do you wonder that? Why do you think you may be dying? And then see what their response is and kind of use that and use question asking and open-ended questions to see really what their understanding is and what their real questions are and how you can help address those questions. So I hope that's at least a little bit helpful. I don't know, Abby, if you have more that you would add to that.
I mean, I agree, Amanda, that it's just so unique to different families. I do know that, at least with the siblings that I work with, they are often thinking about things before they're being talked about in their families. I am always, especially our maybe non-affected siblings, they've got big wide open ears. They're listening to everything. And so yeah, I think like Amanda said, asking questions and asking kids what they're ready to talk about, because they're often thinking about it.
Great, thank you. There's a similar question. What suggestions do you have to gauge understanding from a child that may have age-appropriate comprehension but delays in verbal communication, such as speech delay?
Yeah, that's a really good question. So I actually will plug one of our doctors, Dr. Morali, is starting a writing workshop where she's going to be encouraging kids and siblings to use writing and drawing as tools for expressing emotions. So I think resources like that are wonderful. Having kids draw or kind of use whatever resources they're comfortable with or able to use to try to express their emotions and feelings and potentially questions to some extent. And then, any types of communication devices or other things that they use just in general can be really helpful for kind of helping to enable some of these conversations too. I'll let you add, Abby, if you have anything else.
Yeah, I agree, Amanda. I think giving kids just other mediums to use, other modes of communication, art therapy, play therapy can be really effective.
Wonderful, thank you. So that's the end of our Q&A. Thank you again, Abby and Amanda, for sharing your experiences and your expertise with us today.
For more information, visit mountainstatesgenetics.org/contact. This activity was brought to you by Mountain States Regional Genetics Network. Please enter this code in the evaluation survey in order to claim Genetic Counseling CEU GS23-05